First and foremost, this is a global dengue situation. From January to April in the year of 2025, it has shown that there are a total case of 2,532,929. There are 976,840 of confirmed cases, around 7,498 of severe cases. There are also a total death of 1,305. Scientists believe that the dengue viruses affecting people today evolved from viruses transmitted between mosquitoes and primates in Africa and Asia. So, what is dengue? Dengue is an infectious tropical disease transmitted by the bites of Aedes aegypti mosquito. Dengue is inflicted in two forms, which are dengue fever, DF, and dengue hemorrhagic fever, DAF. The causative agent of dengue is the RNA virus of family Flaviridae, which is called dengue fever virus, Dengue. There are 4 different but related strains of the virus called Dengue 1, Dengue 2, Dengue 3, and Dengue 4 serotypes. These are arboviruses, where they are transmitted by arthropods, especially mosquitoes or ticks. The main cause of dengue is the presence of stagnant water, which provides ideal breeding grounds for Aedes mosquitoes. Place where water can collect and allow mosquitoes to lay their eggs include discarded containers and rubbish, such as cans and plastic bottles, which can trap rainwater. Flower vases with standing water also serve as breeding sites. Walls or drains where water gets trapped, and rusty barrels or drums filled with water attract mosquitoes as well. Old tires that collect rainwater and uncovered water buckets are also shown as potential sources. These are all the common symptoms of DF. One of the symptoms is high fever, which is around 40 to 40.5 degrees Celsius. Besides that, people will suffer from severe headache, especially in the forehead area. People will also suffer from pain behind the eyes, which also known as retroorbital pain. A skin rash may develop, usually appearing 2 to 5 days after the fever begins. Nausea and vomiting, which are digestive issues caused by the infection. Mild bleeding from nose or gums can also occur due to a decrease in platelet count. Muscle and joint pain is also common and can be extremely intense, earning dengue the nickname breakbone fever. These are the severe symptoms of DAF. One of the warning signs is severe abdominal pain, which may indicate internal bleeding or organ involvement. Persistent vomiting that continues even after other symptoms subside is another sign of worsening illness. Bleeding from the nose or gums becomes more serious in this stage due to damage to blood vessels and very low platelet levels. Some patients may vomit blood or pass blood in their stool, which are clear signs of internal bleeding and serious complications. In addition, extreme fatigue or restlessness may occur. Difficulty in breathing can also develop, often caused by fluid buildup in the chest or lungs, indicating a critical, life-threatening situation. The treatment for mild dengue fever is that patients are advised to get plenty of bed rest to help the body recover and fight off the virus. Resting also helps reduce fatigue and prevents the condition from worsening. It is important to drink plenty of water to prevent dehydration caused by fever, vomiting, or loss of appetite. Staying well hydrated helps the body maintain normal function and reduces the risk of complications. To reduce fever and relieve pain, patients can take acetaminophen or paracetamol. For DAF, patients must be closely monitored by healthcare professionals to detect any signs of complications early. Monitoring includes regular checks of vital signs, fluid levels, and platelet counts. Hospitalization is often necessary to provide continuous medical care and ensure the patient's safety. In the hospital, intravenous for fluids are given to prevent dehydration, maintain blood pressure, and ensure that blood volume remains stable. But people should know that there are no specific cure, vaccine, antiviral, or antibiotic for dengue fever. To avoid dengue, we should add larvicide to water containers and man-made ponds. Besides that, introduction of larvae-eating fish in the pond, such as Poecilia reticulata and Gambusia affinis, is also a must. Last but not least, fogging with insecticides should be done by the relevant authorities. These are the ways to prevent ourselves from being bitten. Firstly, we can wear loose clothing that cover all body. People can also use mosquito coils, mosquito repellent, and mosquito net, staying in air-conditioned room, and avoid being outdoors in the early morning and before sunset are also ways to prevent ourselves from being bitten. In conclusion, dengue is a serious but preventable disease. By raising awareness and taking proper preventive steps, we can protect ourselves and our communities.